This is a patient who is saying, you end up picking up this bit or this bit or this bit or this bit and then trying to join them together. And that works. That might be over 10 years as opposed to over a couple of months. So that kind of difficulty of piecemeal provision of self-management information being hard to pick up. And a GP saying one of the difficulties that they encountered, and this was a kind of frequent report, is as soon as you go down that route of discussing emotions, they found that the patients would accuse them of saying that it's all in their head and they're making it up. And that's a difficult road for them to try and navigate and to manage. And in terms of the patient experience, I think self-management can be a slightly off-putting term for some patients, signaling that the doctor's not interested, saying, on you go, I can't do anything about this, you have to deal with this yourself. And patients saying, I think one of the hard things that is, as well as you don't have a diagnosis, you go from A to B and it's not this, so we'll try this, and you understand that it's about elimination, but it can be very frustrating. Limited treatment options also interrupted the provision of self-management advice in primary care consultations. And GPs were often found saying, at medical school they were trained that if there's a problem, there's a solution, and those solutions most times are to do with giving patients prescriptions. And of course, patients have those beliefs as well. When you go to the doctor, you expect to walk out with a prescription for some medication. But physios were saying as well, they're aware that they should be doing self-management with their patients, but when you've not got any training in it, it's like, what do I do? Where do I start? It's a massive area. So having that resource and having a refresher is obviously really good. And there's organizational constraints as well, and the kind of well-documented, time-limited GP consultations, usually a maximum of 10 minutes, and that leaves GPs feeling like they've got little time to do anything else apart from just give a prescription. And the patients themselves noticing this as well, feeling that they weren't being treated holistically. If they required any specialist help, they were being sent off to separate services, so feeling like they were hacked off into bits and separated out into separate parts of the NHS. So we managed to write this up, and we published this research in the British Journal of General Practice. There are barriers to self-management with chronic pain in primary care. And the results of that compare very similarly to other qualitative studies that have been done looking at barriers to self-management, not necessarily with pain, but with other chronic conditions as well. And kind of similar stories were being told in all of these studies. So the Barriers Project found that healthcare professionals and patients both found it hard to discuss self-management. Emotional problems were particularly difficult for both sides to cover. And that the medicalization of treatment often prevents progress with adopting self-management strategies. And that self-management advice itself needs time and also a structure to kind of help both sides make progress.